Hello and welcome to this video, part 3 of the herniated disc. My name's Dr. David Russ and welcome to my channel. If you're new to my channel, it's nice to see you. If you're a returning viewer, it's nice to see you. And if you're a patient who I sent here because you came to me for help with a herniated disc, you are welcome too. I practice in Portland. I have been doing this for 27 years. I have helped hundreds of people with disc herniations make it through. Sometimes people need surgery, sometimes people need cortisone injections, but most often not. If you do need those things, I want you to know that's not a failure. It's just the way that it worked out for you. Everybody comes to this with a unique set of challenges and history and difficulties and advantages. This is how sometimes it works out. But for the most part, with the right approach, people do get better and heal on their own and get back to normal. And that's what this video is about. This is part 3. Part 1 was, how did this happen? Why does this hurt so much? And why is this so scary? Part 2 was about the stages of healing: acute, repair, and rehabilitation. This is part 3, and this is about treatment and rehabilitation and how do we move forward. There are 2 main parts to the rehabilitation of a herniated disc. One is good hands-on care. This is my specialty. Doing myofascial work and gentle traction at the right times and in the right places to help ensure circulation, decrease pain, and do our best to make sure that this heals with a minimum amount of scarring and a maximum amount of healthy function. So that's the manual therapy part. Number 2 is re-stabilizing, or sometimes stabilizing, because the reason it was injured in the first place sometimes is that there was not enough stability. So that's using incremental, safe, targeted exercise to restore stability to the spine, whether that's the neck and shoulders and head for a cervical disc, whether it's a lumbar disc and we need to focus more on the lower core, either way. And I want to say from the very beginning that stability is not strength, and strength is not stability. Stability depends on balance, awareness, coordination, and strength, and not strength alone. So let's do a little bit of quick review. How did this happen? You can see on this diagram how the outer, this part in red or pink, is the annulus fibrosus. It's tough and fibrous, and it makes a circle around the inner part, which is gelatinous and smushy. And that's how the disc is structured. Over time, this annulus fibrosis will start to break down, and you get little tears like this, and sometimes they coalesce into a big tear, and sometimes a big tear happens all at once. And when it's torn and weakened enough, that inner nucleus pulposus leaks out and presses on the nerve. And that is a herniated disc. It's very, very painful. There is no extra space in that canal. If we look here, you know, when we see this canal on anatomy diagrams, it sort of looks empty like this. Sometimes you'll see it with a nerve just kind of hanging out in there. But this actually is what it looks like in real life. It's full of fat. That's all the yellow stuff. The blue are ligaments holding everything together. There's nerves, there's arteries, there's veins, there's lymphatic vessels. There's not a lot of space in there. And so when there's swelling from the injured disc, the pressure that it creates is enormous. And that is really where most of the pain is coming from. We talked about the layers of your pain. The disc itself hurts. The nerve is being irritated by the physical pressure of the disc, the fluid pressure of the inflammation, and chemical irritation from all the inflammatory chemicals that are in there. All of that is very irritating to the disc. And that is that hot, sharp, spreading pain down your shoulder and arm for a cervical disc, down your hip and leg for a lumbar disc. It's terrible. The other layer of pain is muscle pain, because the muscles in the area, whether it's neck or low back, are trying really hard to hold this together, and they get tired and they start to ache as well. The neurological issues around this pain are enormous. Number 1, the compression and irritation of the nerve root itself. Number 2, the fact that the entrapment here is directly connected to this ganglion, which is a cluster of nerve cells that regulates your fight or flight response. And there'll be another one on this side, and they'll be connected. So that is why this pain is often accompanied by a lot of emotional overlay: fright, anxiety, despair, the feeling that you're never going to be better, the feeling that this is your life from now on and you cannot see a way forward. That's a part of the pain. It's not true. You will get better and you will have a way forward and you will get back to normal. You will. Here's a list of typical symptoms and pictures for people in different stages of this injury. The acute stage, characterized by a lot of swelling, and you can't see the swelling because it's way, way, way deep inside, but it's in there and you can feel it. Tons of pressure. You feel so stiff, you cannot move. The pain is local. The pain is shooting down your leg or shooting down your arm. Numbness and tingling are also different aspects of this nerve irritation that you might be experiencing. Any activity is going to cause you pain. Folks who are in the acute stage, like get out of bed, you put on your shoes, you walk a block and you're like, I'm done. I got to turn around. I got to go home and lay down. I cannot do this. That's acute disc herniation. The swelling is intense. The pain is intense. And any activity is basically not tolerated very well. In the repair stage, things are starting to lighten up. It still hurts. You're still stiff and stuck. There's still going to be maybe some numbness, tingling, and nerve pain, but not as much. And you have a little more tolerance for activity. When you're in this stage, the repair stage, like you can get up and walk a mile and then you're really tired and you got to go home and put your feet up and lay down and get the weight off of it. Whereas in the rehab phase, once the repair is mostly done, it's stiff and it's achy. The nerve pain is minimal and you really are able to do more. You just feel sore a lot. You feel stiff a lot. And there will still be sometimes like a long car ride or a lot of computer work or a lot of sitting or a lot of walking where some of that nerve pain starts to come back because it's not fully healed. During that transition from the acute stage to the repair stage, one of the key things that happens is the formation of granulation tissue. Granulation tissue is the scaffolding that your body builds to create space and provide passage for new blood vessels, because new blood vessels need to grow in order to heal your disc, and for the cells called macrophages and other types of immune cells and repair cells to come in. They need that granulation tissue to provide passage and a way for them to come in. And if you look at this on the left, this is what the dense connective tissue looked like when your annulus was healthy, and it's really, really strong. And on the right, you can see what granulation tissue looks like under the microscope. It's kind of disorganized, and there's a lot of space in there where the dense connective tissue is a bunch of fibers all running in the same direction, which is what gives it its strength. So one of the keys to getting out of the acute stage and into repair solidly is to allow this granulation tissue to form without re-injuring it. Now think about a building and the wall or window has been damaged, and the workers have to come and build scaffolding in order to repair it. They need to put up the scaffolding because that's what they stand on, and that's what holds their tools and the materials that they use to fix the wall. The scaffolding is not a wall. It's not as strong as a wall. A strong wind or some real sudden instability could wipe that scaffolding out, and they'd have to start over rebuilding the scaffolding from scratch. That's what happens to people when they overdo it during the acute stage or the early repair stage. They wipe out their granulation tissue. Then you're starting over. Your body has to create new acute inflammation in order to create new granulation tissue and create new, small, delicate, fragile blood vessels and bring in new immune cells to bring away the fragments of injured tissue and repair the tissue and lay down new, fresh, fibrous tissue. So this happens to people a lot. People get stuck in the acute stage because they're overdoing it. And a lot of times, people are getting bad advice. So here's a situation that I see very frequently, and this may describe you. People have low back pain. It starts to spread down the buttock into the thigh, all the way to the foot. Or they have neck pain. It starts to spread into the shoulder, down the arm, sometimes all the way into the hand. They go to the doctor. Doctor gives them some painkillers, some anti-inflammatories, sends them home, and there is a prescription for physical therapy. People go to physical therapy, and the physical therapists give them exercises. And the exercises are meant to mobilize and stabilize the area, which are good intentions, but it's too soon. And the performance of these exercises re-injures the person, and it irritates this tissue because it's too soon. I have seen this happen so many times. They just start too soon, too aggressively. It is so hard to wait. When you're in acute pain, especially disc pain, you're like, I have to do something, right? I have to do something to make this go away. The thing you need to do is rest. And this is hard. This is hard for people. But when you're in acute disc situation or in those early stages of repair, it's a very delicate granulation tissue that you're dealing with, and you have to rest. The best thing you can do is focus on getting the swelling down and not re-injuring yourself. Now, if you're in the acute stage and you're watching this video, I'm going to put a QR code up on the screen right now. If you feel like I'm speaking intelligently about this, I suggest that you scan this QR code and go to my Fullscript Dispensary. Fullscript is a very reputable online resource for all of your supplements, herbs, a lot of wellness products. All of my viewers, that includes you, have 20% off everything every day. Shipping is fast. The selection is huge. I have protocols there. One is called Acute Disc and the other is called Disc Healing. So if you're in the acute stage and you want to know what I recommend supplement-wise broadly, go check that out. If you're in the repair stage and you want to know what I recommend to support and facilitate the healing and the formation of good, strong, integrated tissue, then you can look at that as well. My disclaimer is I don't know you and I don't know your allergies and intolerances, so please be aware of that and please be careful of that. Additionally, if you want to talk to me about your specific situation, including what supplements and herbs might be best for you individually, I am available for telehealth. I can help with diagnosis, treatment planning, helping you understand what happened and your way forward. Here is a QR code that will take you to my contact form. I am not hard to reach. If you email me, I will email you back, usually within a couple of days. I'll do my best. Long story short, if you're acute, you need to rest, get the swelling down, and avoid re-injury. And this is a really good time to put some effort into cleaning up your diet. Specifically for most people, pro-inflammatory foods are fried foods, alcohol, nicotine in all of its forms. Those are the things you need to kind of cut out. So simple food, things that are easy for your body to digest. I love bone broth. I love steamed or lightly sauteed vegetables, whole grains like brown rice, eggs, avocados, bread is good, butter is good. This is kind of the whole food diet thing that I'm on. I've been on for a while. If you're in the repair stage, you still want to keep your diet clean, not be drinking and smoking, and not eating a lot of heavy fried spicy food. But here is where the gentle movement starts to come in. Gentle body work from someone who knows what they're doing. Now, sometimes I have to say, body workers will get into a mindset of they have to prove something to you and how magical their technique is, and they wind up overdoing it. So any treatment for a disc has to be gentle, conservative, and incremental because the cost of overdoing it is enormous to the patient. You can set them back. Okay, so I'm available if you're in Portland or near Portland. Come and see me. Pain relief, whether that's over-the-counter analgesics, whether that's a prescription medication, which you need to use very, very judiciously, herbs, supplements, all sorts of things out there, topicals, CBD, whatever you need to do to keep the pain down will help you because you need to break that pain spasm cycle. Avoiding re-injury in the repair stage is extremely important. Continuing to nourish and rest. When I talk about gentle movement, what do I mean in this repair stage? For the lumbar disc, I mean gentle bridges, maybe not bridging up all the way, just bridging up part of the way. Bridges are lovely, gentle mobilization. The pelvic tilt, which is kind of like the introduction to the bridge. It's what you need to master before you get into the bridge. Sometimes it's called an imprint. That's another great thing to do during the repair stage. Get some movement, get some awareness, proprioception, start engaging those deeper muscles and encouraging circulation through the area. The cat-cow variations, gently. That needs to be approached very conservatively during the repair stage. For a cervical disc in the repair stage, things that open the shoulders, things that gently mobilize your neck, things that open up your ribs and breathing. Now, I will put in the video description a lot of links to the videos that I have of me doing these exercises with you, talking you through it so that you can do them gently and be confident that you are doing them correctly. In any disc repair, the gentle movement I'm talking about also includes whole body movements such as walking, swimming. Swimming is great. An elliptical machine, which is a really good whole body, low impact way to get your heart rate up and recondition your whole body. Stationary bike, similar. Tai Chi or similar are also really good. I think yoga is wonderful, but there's a lot of risk of overstretching in yoga, and in a repair stage, the risk is pretty great. And with a cervical disc, any inversions will be contraindicated. So I often do not recommend yoga to people who are healing a disc unless you are an experienced yoga person and know your limits and are willing to adhere to them. Now, how do we approach this rehabilitation phase? What do we want to accomplish? Most importantly, we want to accomplish the completion of the healing with minimal scarring. So I use the word scarring, but most people think of the scarring as being a scar as like on the skin. So the real term, the technical term, is fibrosis. Fibrosis is a condition of too much, too stiff, too dense, too thick, not elastic enough tissue being laid down inside the body in an area of injury. It is the body's intuition and instinct to do this because it wants to protect the area from future injury. But we want to maintain your function. A major intent of bodywork and exercise in the rehabilitation of a disc is to minimize that fibrosis so that whatever tissue is laid down is as functional as possible. Number two, of course, avoiding re-injury. We don't want to set you back. Good days happen, bad days happen, sometimes a string of bad days. That doesn't mean you necessarily are set back to the beginning, but we want to avoid setting you back to the beginning, and we want to avoid and minimize the number of bad days that you have. During the rehab stage, soreness and stiffness is normal. That's going to be with you for a while. But we want to avoid re-injury. We want to restore you back to your full function so that you can get through your day and do the things that you want to do without pain, without fear. A little bit of pain here and there is not unusual. We need to prepare and have resources for occasional minor pain, and we want to create habits, good habits for good, sustainable, long-term health and conditioning. How do we do this? Well, the hands-on is very important to me. That's my career. That's my life's work. Myofascial release and myofascial alignment or myofascial chiropractic, taking a full body approach, but focusing on the area of pain. Now, if a person has a disc herniation in the neck, in the cervical spine, we need to look at the scalene, the SCM, the levator, the upper trap, the suboccipital, the jaw, the cranial, the pectoral, and all those areas that contributed to the slow, gradual breakdown of that disc that eventually led to the major herniation. But also, this whole shoulder girdle sits on the rib cage, so we need to work on opening the ribs and the breathing. And the rib cage sits on the lumbar spine, which attaches to the pelvis. You kind of see where I'm going with this. We have to take a full body approach. That doesn't mean every session is full body, but it also means that every session is not just focused on the area of pain. The other part, other than the manual therapy, is the part that you do, progressive stabilization, restoring balance, coordination, and strength from the ground up. And just like with the hands-on, the manual therapy, and the myofascial work, you can't just focus on the area of pain. It's got to be a whole body thing. So if the head is way forward, the shoulders come forward, that does put strain on the lower back over time. We want to avoid that. We want to get that out of there. Reconditioning also of the whole body means flexibility, mobility, and cardiovascular fitness, which provides you with resilience. When you have flexibility, mobility, core stability, and good circulation and good cardio, you're going to be resilient, and your chances of getting re-injured are going to go way, way, way down. Now, I have some videos on my channel. One in particular is called The Foundation of Fitness. It's kind of long, like this one, but it's a deep dive into how to get your aerobic capacity, how to get your heart and lungs working well, how to get your blood as rich with oxygen as possible, and the things that this does for you and your health are just enormous. Mood, energy, appetite, sleep, sexuality, everything, cognition, the way that you think, your posture. It just is really the foundation for all fitness. And when you're in the rehab stage, it is safe to get on your elliptical. It is safe to go for walks, climb stairs, climb hills, do things you need to do to get your heart rate up on a regular, consistent basis. That's going to strengthen your whole body metabolically as well as structurally. Now, we want to also put in place resources for episodes of pain, because everybody deals with pain every once in a while. And once you've had a disc herniation in a certain area of your body, it will heal, but it will never be as good as it was originally. It doesn't go back to what it originally was. So we need our body workers, an acupuncturist. We need to have our supplements on hand. We need to know which analgesics work best for us, which don't irritate our stomach. And of course, when you do have these episodes of pain, going back to the basics of your stabilization exercise. Sometimes when people start feeling better, they stop doing their bridging, they stop doing their core stabilization, which is normal and natural and fine. But when you find yourself starting to hurt again, one of the resources you have available to you is those exercises. And I will link to exercises on my channel, which I hope that you will watch and participate and do with me. When it comes to the hands-on treatment, it takes an experienced practitioner and someone who is skilled and dedicated to handle a disc herniation properly. The depth, the speed, and the intensity of the treatment have to be carefully modulated every visit. So this requires good communication with the patient, as well as sensitive hands and a lot of attentiveness. Not everyone has that. Not every massage therapist or physical therapist or chiropractor works the way that I do. So I want you to be really careful and selective about who you work with. A lot of rotation and those kind of thrust cracking adjustments are not appropriate. Those are not indicated for people who are rehabilitating from herniated discs. And everybody presents with their own history. And so your provider needs to be able to modulate and attenuate and change the treatment based on you and your specific needs and wants, and be ready to shift and change things if what they're doing isn't working. What does hands-on treatment consist of? Primarily the myofascial work, which will reduce pain, reduce inflammation, stimulate healing, improve circulation, and improve body awareness. We also use cupping. Cupping is great for skin level tension and those first layers right underneath the skin. Some people call it the adipose. It's really better called the superficial fascia. And it's not inert. It's full of nerve endings. It's very sensitive. It's very supportive. It's extremely important tissue, and it creates a lot of tension and can hold a lot of tension. And cupping is a very nice, non-invasive, and safe way to deal with tension in the superficial layers. I have found over the years that acupuncture can be great for nerve pain and musculoskeletal pain. So again, finding a practitioner who is good at what they do and has experience with disc herniations can probably help you a lot. Now, we talked about the manual part, the hands-on part. Now let's talk about the core stabilization. First and foremost, I'm going to say it again, strength is not enough for stability. If you look at the Eiffel Tower, it's very, very stable. It's made of iron. Iron is very, very strong. But it's not the strength of the iron that gives it its stability. It's the fact that it has a very level foundation, it is balanced, and it has flexibility. It can sway in the wind. It can move a little bit. That is what gives it its stability, and it's the same with your spine. It's the same with your body. What goes into stability? Yes, you need to have strength, but you also need to have coordination. The ability to use the muscles of your core, of your neck and shoulders, and your breathing muscles in a coordinated, concerted, efficient way, which means you need to have awareness. You need to be able to connect with and engage those muscles individually. You need to have balance. You need to have awareness of your body position and movement through space. That's called proprioception. There's the muscular property known as responsiveness. How quickly does it contract or relax based on the needs of the moment? That's not the same as strength. There's flexibility and elasticity, the ability of the muscle to lengthen and return to its previous form. And then we have strength. And if we look at these things, coordination, balance, awareness, and responsiveness, these are all neurological. These don't really have anything to do with the muscle itself. This is how well your nervous system works and how your nervous system responds and communicates with the muscles of your body. The flexibility and the strength are about the actual physical condition of the muscles themselves. So I'm kind of harping on this because you see people and they're focusing just on flexibility and strength and not on balance, awareness, coordination, and responsiveness. And they're really, really important things. The beauty is it's not that hard to get those things. It's not complicated. It's just a different approach and really a different mindset, and one that I'm hoping that after watching this video, you will come away with this mindset. Here are some of the exercises that we do for stability. We do these quadruped exercises. This is often known as the bird dog. So this looks like it's mostly stabilization in the front to back plane. But once you lift one arm and opposite leg, there's a lot of rotational force going through your body. And to keep yourself stable is exactly the kind of movement and stability that we're trying to impart into your spine. There's stabilization exercises that you do supine or face up. These are called often the dead bug and bridging. Bridging on one leg is not just a gluteal exercise. It's an incredibly important, deep rotational stability imparting exercise as well. And it's very safe, even in the repair stage, because when you do it, there's not much movement going through the area. So you're able to exercise these stabilizers without endangering the healing of the disc. We have to remember that we have side body too, what we call the lateral line. And engaging that lateral line with leg lifts and single leg stance work is very, very important. Imparting rotational stability through these movements is really kind of the key to treating and preventing future disc herniations from happening. And then things like bridges to, strengthen the glutes and the hamstrings and the large supporting muscles of the lower body, which do help support your spine and keep you from overusing the smaller muscles. Now we have advanced, more difficult core exercises that are primarily for strength. These are the things that I see people in the gym doing too soon. And I'm talking about squats, deadlifts, and planks, for example, which are all great exercises. Deadlifts are great, squats are great, planks are great. But if you do them without first imparting good balance, coordination, and awareness, you're going to miss the boat. You're going to be creating strength without giving additional balance and coordination, and it's not going to be as helpful long term. When it comes to restoring mobility and flexibility and elasticity, I'm talking about movements that are whole spine movements like the cat-cow and its different variations. I've got a video that I will link to in the video description on that. I have a seated spinal mobilization. It gets from your tailbone all the way to the base of your skull, everything moving together, integrated with the breath. It doesn't take very long. It's incredibly refreshing, and it's very, very good, safe, healthy movement for the whole spine. Mobilizing the hip and the lumbar spine and the pelvic floor. These things are all super important. And similarly, the neck, shoulder, rib cage, and head, moving those in a way that is integrated with the breath and that's safe and doesn't endanger the disc when you do it. When it comes to full body reconditioning, again, I'm going to refer you to the Foundation of Fitness video that I have here on my channel. No impact or low impact cardio, cycling, elliptical, walking, hill walking, stair walking, and just in general, becoming an active person. The cost of this pain and this loss of ability to live your life is just not worth it. And that you'd rather put the time in to become a person who walks every day or 4 times a week, a person who gets on the recumbent bike when they watch TV. Those are changes that you can make. Finally, we have to be ready to respond to pain, whether it's during the healing process or after. When the healing process is done, you still will have times of pain, and it's scary. When someone has experienced a bad disc herniation in their neck, and they come up with neck pain one day, a couple years later, even many years later, it triggers a lot of fear. And we want to remember that we don't need to freak out, that it took probably weeks or months for that disc herniation to happen in the first place. We're going to respond to this with our basic stabilization and mobilization exercises. We're going to use our supplements and our over-the-counter analgesics to cut that pain. We're going to rest because we know how important rest is to the healing process, and we're going to get back to the basics. It's super important. Any stage of life, any stage of injury, even if you're healthy and nothing is wrong, to build rest and recovery time into your day, into your week, especially when you're healing a disc. After you have, say, done a low-impact cardio session, you're going to need to have some time to rest. That is just relaxing, letting the blood circulate and do its magic, and not just kind of being harried, but allowing yourself time to rest, recover, prioritizing sleep, and also having fun when you can. And as you're healing and your capability gets better and your impairment gets less, there's going to be more and more time for the things that you really like to do, whatever that may be. This is a marathon. Healing a herniated disc takes months, even under the best of circumstances. If anyone out there is telling you that they have some magical cure that's going to make this better tomorrow or in 2 weeks or whatever, I want to take that with a lot of grains of salt. I have seen many, many, many of these in people young and middle-aged and elderly, people with metabolic conditions like autoimmunity and nutritional deficiencies, people who are healthy and fit and active. It takes months. Think about NBA players and football players. These are the most highly conditioned athletes in the world. These are the people with the most incredible health care. They get treatment every day. Someone's watching everything that they eat, all of that stuff, right? One of those people herniates a disc. They are out for the season. Whether they have surgery or not, it's going to take them a year to get back to playing full basketball or football. That's just the way it is, even for the most conditioned athletes in the world. Now, I'm not one of those people, and I'm guessing you're not one of those people either. So be ready for this to take time, but don't despair, because you're not going to be in this pain for months and then one day wake up and be fine. It's going to slowly get better over time. You're going to have good days. You're going to have bad days. We want to try to stack good days together. That's really, I think, the best mindset you can have right now at this point. Understand that it will fluctuate. I might have actually should have said this 20 minutes ago in this video, but it's natural during the repair stage. I did say this in part 2. It's natural during the repair stage for the swelling to come and go. It'll swell up, some fresh blood and new cells will come in, and that's going to make you stiff and achy for a few days. And then that's going to subside and you're going to get a break and your pain is going to go down and your movement is going to be freer again. That's normal. It's natural. The cyclical nature. The idea is don't freak out when things get a little bit harder, and don't overdo it when things are feeling easier. It's a marathon. We want to pace ourselves. So I've been talking now for about half an hour, and I think I'm going to wrap it up. I have lots more to say, but it's been half an hour. I appreciate you watching. I appreciate you sticking with this video to the end. I invite your comments and feedback in the video description, in the comments section. Any questions, you can drop them in the comments. I'll do my best to respond. If you want to talk to me specifically, again, there's my contact link. Will be in the video description, or you could rewind and scan that QR code. So I hope you're doing okay today. I hope tomorrow's a good day for you. This is Dr. Russ from Portland saying thanks for watching. Talk to you soon.